Hi, my name is Christoph Sommer. I'm a heilpraktiker working in Munich, Germany. I met Jean-Pierre Barral, the developer of visceral manipulation and more modalities in the field of osteopathy 28 years ago, and I'm teaching in the Barral Institute and his method for 18 years now. So the joint manipulation, or the new manual articular approach as we call it, is another development that is bringing together the knowledge of the joint capsule, the ligamentous reinforcement, the muscle reinforcement of any kind of joint, and in addition adding the related nerves and the vascularization of every joint. The approach to treat a joint that way, in that complexity, and learn to differentiate which of the mentioned structures are in trouble and need your help, will help you to get very effective and retune your hands to really be specific and helpful to your clients, no matter which joint of the body we're talking about. Looking at the third new manual articular approach class, which is focusing on the vertebral spine and the pelvis, you can imagine that we're having, of course, joint capsules, we're having the discs, but in addition, we're having in the spine also the dural membranes, the nerves, and the vessels that are feeding the spinal cord and the venous drainage that is feeding the discs and allowing the flow circulation to come out of the spine. So learning how to differentiate the levels that you need to treat the spine a lot more specifically on muscular, ligamentous, and disc levels will help you to resolve the general freedom of the spine, which often results in lower back pains, but the lower back pain is just the sum total of all the immobilities you have from above. Of course, as the basin underneath it, you have the pelvis, and the pelvis is, again, needing freedom for walking, for sitting, to be upright and erect, and it needs to have a balance and a stability. So, treating the ligaments of the hip, the pubic symphysis itself is in every step needing to move, and that is allowing the sacroiliac joints to move better. That together will allow you to have a freedom and stability and recreating a nourishing health for the spine itself and the discs, so that you don't only help people out of acute trouble, but you also can prevent them from going into trouble in any kind of aging process.